Yeah, guys, and in this video, we are going to discuss some concerns or facts about Indian Mental Health Act 1987. So, I'm going to talk about some specific point which we need to consider in future while doing a renewal. Or these points are very, very important because in mental health services and the scope of mental health services still in the stigma in India due to lack of resources, lack of budget, lack of proper trained qualified caregivers, etc., etc. So right of the patient with mental illness, in terms of right of the patient with mental illness, or when we consider the right of the patient, right of the family also we need to consider, because in India, in terms of care, the primary caregivers are who? The family, not a caregiver or like Western countries like UK or Canada. There is a number of caregivers and by community health department or by state, etc. But in India, the system is different. So in Mental Health Act renewal, we need to consider this point also in India with because we have inadequate resources for mental health support and lack of qualified caregivers should also need to be kept in mind. Then right to health. Right to health for people with mental disorder means availability of mental health services, right? So it can be achieved only through implementation of effective national mental health program. So we have national mental health programs and there are different provisions for national mental health program, but it is not implemented in the proper way in each state. So right to health in the sense what? Effective implementation of national mental health program. So the government and the responsible authorities need to have a look into that, how we can implement effective national mental health program. So because we are stressing many times about the right of health in chapter 8, 9 and 10 of Indian Mental Health Act. Then a definition of psychiatric hospitals and psychiatric nursing home. This requires to be made bit realistic by appointing one psychiatrist for 100 inpatient beds at least. That's other important point. So psychiatric hospitals, psychiatric nursing homes, and important starting licensing authority. From chapter 1 to chapter 4, chapter 3, detailing explaining about what psychiatric nursing homes, psychiatric nursing hospitals, how it start and what how will grant that or license, how what's the process and what is the definition. So when you think about that, this request to be made a bit realistic by appointing psychiatrist. They are telling in 1987 Mental Health Act, they are specifically saying about the need of psychiatrists, but in reality, there is not much psychiatrist or the qualified people to, I mean, to take care of the mentally ill person. So a bit realistic. We need to be a bit realistic by appointing one psychiatrist for 100 inpatients beds at least. Then psychiatric emergency service. There are no guidelines under Mental Health Act for emergency mental health crisis intervention to help families caring for mentally ill family members. So family, that also we have to consider. 1987 Mental Health Act is specifically focused on the mentally ill person. Okay, how will take care of their properties? How will take care of how will maintain their cost, how will give respect and dignity. Everything is good. At the same time, emergency service also very important. But there is no regulations and guidelines under Mental Health Act 1987 for emergency mental health crisis to help families because they are the primary caregivers. Then choice of treatment. It is silent regarding the consent for treatment and the method to be adopted when a severely ill patient refuses an established treatment like medication or modified ECT, that is electroconvulsive therapy. So the meaning of forced treatment need to be defined and procedures requires to be outlined. That is another thing or concern. Choice of treatment, that also we need to be considered. Then, for while renewal or while talking about Indian Mental Health Act, then role of media when dealing mentally ill person. Sometimes media, including television, cinemas, newspapers, uses this mental illness as a meaning of publicity. Okay, and but under the Mental Health Act, there is no provision or there is no chapter to take action against such human rights violations of mentally ill person. We are talking about the rights of mentally ill person, but while misusing the what mentally ill person's conditions for publicity, in that case, we need some provisions, right, to take action against such human right violations. So we need to talk about that. Then certificates and mentally ill persons. Some families, in some circumstances, in some instance, family members are misusing the patient's medical certificates for their benefit. So the board has to ensure adequate safeguards to protect the mentally ill. So these are all the factors we have to consider, and we need to do a discussion. I mean, we, in the sense, the responsible authorities has to look and has talk about and has to consider while doing new amendments, new things or new renewal in terms of what Mental Health Act, what new things, and in terms of Mental Health Act renewal. Hope you understand, guys. Thank you. And also, Mental Health Authority. Unfortunately, even after 2 decades of Mental Health Act 1987, there are only 5 effectively functioning state mental health authorities in the country. Only 5 effectively functioning state mental health authorities in the country. It's actually because of what? Lack of resources. So hence a yearly budget need to be sanctioned for both central and state mental health authority for the effective functioning. So we need a budget need to be sanctioned for both central and state mental health authority, and you can get more information about these things from these concerns and issues, these references. Hope you understand, guys. Thank you.